Hi, my name is Caitlin Mossam. I'm a family nurse practitioner student at the University of Memphis, and this is my head to toe physical assessment. I'm going to start by scanning the room. And that's all my tools. This is my patient, Christopher. And then that is the eye chart for the patient. All right. Going to set the camera down, make sure we're in view. Okay, so I'm going to start by assessing the skin. So we'll assess the skin specifically of the head, face, neck, anterior chest, posterior chest, and the abdomen. And we're looking for skin color, texture, temperature, moisture, turgor, edema, bruising, scarring, swelling, lesions in nevi. And from there, we're going to move on to assessing the head. So we're going to inspect the head, make sure the head, I'm looking for size, shape, and position of midline on the neck. Then we are going to inspect and palpate the scalp. So we are going to inspect and palpate the scalp, looking for hair color, texture, distribution, any depressions, masses, lesions, areas of tenderness, or infestations. From there, we are going to move on to palpating the temporal arteries for any tenderness, and then we are going to move on to assessing the lymph nodes of the head and neck. So we're going to palpate the preauricular, the postauricular, the tonsillar, the occipital, submandibular, submental, the anterior cervical, posterior cervical, and then the supraclavicular. And then from there, we're going to palpate the TMJ. So when the patient opens their mouth, we're assessing for any subluxation, crepitus, pain, or tenderness. And then we will assess cranial nerve number 5. So for this, we will have the patient, I'm going to palpate the masseter muscle as the patient clenches their jaw. Okay, and then we will do the light touch sensation. So I'm going to grab a Q-tip and have the patient close your eyes and tell me where I'm touching you.
Forehead, cheek, nose, chin.
Okay, and then we are going to move on to the assessing cranial nerve number 7. So for this, it's we're going to assess facial symmetry. So I'll have the patient smile, frown, raise your eyebrows, puff out your cheeks, and then pucker your lips. Okay, and then from there, we are going to assess the ears. So I'm going to look at the ears, assess the size, shape, symmetry, and the position. And then I'm going to palpate the pinna and the tragus for any tenderness or lesions. I am going to assess cranial nerve number 8, which is hearing. And so I'm going to stand on the side of the patient, and I'm going to whisper a word and repeat what that word is.
Apple.
Okay, and then on this side.
Apple.
Okay, and then I'm going to take my otoscope and assess the internal auditory canal and the light reflex. Okay, and then same on the other side. Okay, and then we are going to I'm going to move on to assessing the eyes. So for the eyes, we are going to I'm going to inspect and palpate the brows, lashes, and palpebral fissures. And then I'm going to look at the conjunctiva, open your eyes, and then the sclera for redness, drainage, or lesions. And then I'm going to use the ophthalmoscope and look in the eye, the internal structures of the eye and the red reflex. Okay, and then we are going to assess cranial nerve number 2, which is the gross visual acuity and peripheral vision. So I'm going to have the patient stand up, And I'm going to bring the camera, and the patient is going to do the Snellen test. So I'll have you stand 20 feet away from the Snellen chart, cover one eye, and tell me what you, read the lowest line possible.
CFDHJ.
And then same with the other eye.
CFDHJ.
Okay, and then with both eyes.
CFDHJ.
Okay, and that's your testing for the vision, the 20/20 vision, and you can have a seat. So then we are going to move on to assessing cranial nerve number 3, which is direct and consensual pupillary restriction to light. So just stare straight ahead at the wall. Okay, and then this side. Okay, pupils are equal, round, reactive to light. And then we're going to test accommodation and convergence. So follow the tip of the pen with just your eyes. Okay. And then I'm going to test cranial nerve number 3, which is the extraocular movement. So again, just follow the tip of my pen for me. Okay. Okay. And then and so that was cranial nerve number 3, 4, and 6. And then, so did the eyes and the accommodation and the 3, 4, and 6. And so now I'm going to move on to assessing the nose. And so for the nose, we're just going to look at it to make sure the alignment, position, size, shape, middle of the face. And then I'll test nostril patency, so breathe out for me as I'm including one nostril, breathe out another. And then I'm going to test cranial nerve number 1, which is smell. And so I'm going to grab this, and so close your eyes and tell me what you smell.
Alcohol.
Okay, and then we are going to move on to, then I'm going to palpate the maxillary sinus and the frontal sinuses. And then we're going to move on to assessing the mouth. So for the mouth, I have the patient open their mouth, and I'm going to inspect the lips, gums, teeth, tongue, under the tongue, the palate, the buccal mucosa, the palate, the salivary ducts, the posterior pharynx, and then the tonsils, and you would grade the tonsils if the tonsils are present on the patient. And then I'm going to assess cranial nerve 9 and 10. So the patient, open your mouth, stick out your tongue, and say ah. And then that's your assessing the uvula and palate rise equally with phonation. Then cranial nerve number 12, have the patient open their mouth, stick out your tongue, move it from side to side, and the tongue is midline with no fasciculations. And so from there, I'm going to move on to the neck. We already did the TMJ and the cranial nerves. So I'll move on to the neck. So I'm going to inspect and palpate the trachea, that it's midline position and straight, no tenderness. And then I'm going to come, if you can turn that way, I'm going to come from behind the patient and swallow for me. I'm assessing their thyroid glands for any tenderness or lesions. And then I am going to assess their carotid pulses. So we'll just assess the carotid pulses on both sides. And then I'm going to take my stethoscope with the bell, and I'm going to assess the carotid pulses for any bruits. So take a deep breath and hold it for me. Okay, and then same on the other side. Okay, so from there, we are going to move on to the posterior chest. So I will have you turn, yes, and I'm going to move the camera just so we can see back. Okay, and then if you scoot up a little bit. Okay, so for the assessment of the posterior chest, you want to first inspect for any obvious deformities, and then for symmetry. And then you're also going to want to inspect for signs and symptoms of respiratory distress, which would be nasal flaring, retractions, patient in the tripod position, cyanosis, tachypnea. And then we are going to palpate for equal chest rise and fall, the patient's breathing. And then I'm going to palpate tactile fremitus, so the bony side of my hand. So have the patient say 99.
99, 99, 99, 99.
Okay. And then I'm going to percuss the lung fields, the posterior lung fields. And we're making sure to go down to the bases and the lateral lung fields. And then now I'm going to auscultate the posterior lung fields with my diaphragm. So the patient, just have the patient, we're going to start above the scapula and do it using the intercostal spaces. So just breathe normal for me, deep breath in and out. Okay. And again, you're going down to the bases and the lateral lung fields. And then we are going to auscultate for agophony. So have the patient say E every time they feel a stethoscope.
E, 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 E.
And then again, I'll do it with the assess bronchophony. So say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. And then whisper pectoriliqui. So whisper 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Okay. Then from there, I am going to move on to assessing the anterior chest. So we will again start by inspecting for any signs of respiratory distress and assessing the symmetry and any obvious deformities. And then I'm going to palpate for the equal rise chest, or the chest equal rise and fall. Okay, and then the tactile firmness again, so 99.
99, 99, 99, 99.
Okay, and then I'm going to auscultate the anterior lung sounds. And again, going down to the lateral lung fields, bases. Okay. And then from there, we are going to move on to assessing the heart. So for the heart, I'm going to start by auscultating the 5 heart valves. So we will do the right side, second intercostal space, right sternal border. Is going to be the aortic valve. And then the second intercostal space, left sternal border is pulmonic. Third intercostal space, left sternal border is Erb's point. Fourth intercostal space, left sternal border is tricuspid. And then the mid-clavicular line, 5th intercostal space is a mitral valve. And then at this, we also want to palpate at the point of maximal intensity there. And then we will also listen for a full minute for the apical pulse and record that rate and rhythm. And then we're going to repeat with the bell. So you would do the same 5 heart sounds the aortic, the pulmonic, the Erb's point, tricuspid, and mitral with the bell. And then I will have the patient lie down. Yeah, I mean, that's perfect. That works. So the patient now in lie down position, their head is raised 30 to 45 degrees. So I'm going to have them look at the wall, and you're assessing jugular venous distension and pulsation. Then look towards me. Same thing. Okay. And then I'm going to just inspect the chest for any heaves or lifts. I will palpate all 5 of the heart sounds or all 5 of the heart valve areas for any thrills. So you'll do the apical, the pulmonic, Erb's point, tricuspid, and then the mitral. And then I will repeat the auscultation with the patient lying down with my diaphragm and my bell to all 5 of those heart sounds again. And then I am going to move on to the abdominal assessment. Just make sure I can get your abdomen in it. Okay. So for the abdominal assessment, let's.
Just give it back a little bit.
Okay. So for the abdominal assessment, I'm going to inspect the abdomen first. For obviously you would have the patient take their shirt off, but for privacy reasons, we can keep it on. I'm going to inspect for contour of the abdomen, any obvious like lesions, and the shape of the abdomen. We are going to then auscultate the valves in the abdomen with my bell, so listening for any bruits. So we are going to auscultate the aortic valve, the renal valves, the iliac valves, and then the femoral valves in the groin. Okay, and then we are going to use the diaphragm and listen to all 4 quadrants of the abdomen for the bowel sound. So you do the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. And then I'm going to percuss all 4 quadrants, and we're going to listen for any tympany, flatness, or dullness. So the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. And then I'm going to do palpation of all 4 quadrants, and we'll start with light and then go to deep. So you do light palpation, right upper quadrant, light palpation, left upper quadrant, light palpation, right lower quadrant, left palpation, light palpation, left lower quadrant, and then repeat the deep palpation on the right side, and then deep palpation on the left. And then we're also going to palpate for the liver on the right side under the ribs, and it should be non-palpable. And then same with the spleen on the left side, again, should be non-palpable. And then from there, I'll have the patient sit up. You can sit up and then face that way for me. Okay, and then we're going to assess for CVA tenderness. So I'm going to percuss down here and let me know if you feel any tenderness.
It's okay. It's okay.
Okay. So then from there, we are going to move on to the musculoskeletal assessment. So for the musculoskeletal assessment, we'll start with the upper extremities. So for the upper extremity assessment, we are going to inspect the skin of the upper extremities, and then inspect and palpate the joints of the upper extremities. So the hands, wrists, elbows, shoulders. We're looking for symmetry, for crepitus, for any pain, tenderness, swelling, nodules. And so, and then we are going to start with the range of motion for the fingers. So I'll my lead, and you would just flex your fingers, extend, hyperextend, abduction away, adduction together. And then for the wrists, just make a fist, and then you're gonna go flex the wrist, extend the wrist, hyperextend, radial deviation, ulnar deviation, and then rotation. For the elbows, you want to flex the elbows, extend the elbows, hyperextend. And then for the shoulders, we are going to you're going to flex the shoulders, extend, hyperextend, and then we're going to do abduct away, adduct towards, okay? And then internal rotation, external rotation behind the back, and then circumduction in a circle, okay? And then we are going to move on to assessing the strength in your joints. So squeeze my hands for me, okay? Grip strength 5 out of 5, and then flex your elbows for me. Push against my hands, okay? And then pull against my hands. So that's assessing the strength in the elbows. And then we're going to assess the strength in the triceps and biceps, and then we're going to assess the strength in the shoulders. So fold your shoulders over for me in the front, and then push down on my hands, and that is adduction, and then push up, and that's abduction. And then I'm going to assess cranial nerve number 11. So shrug your shoulders for me under resistance. So cranial nerve 11 is intact. Then we're going to move on to assessing the cerebellar function. So for this, we're going to do rapid hand movements. So just kind of flip your hands for me. Okay, and then touch your fingers to your thumb. Okay, and then we're going to do finger to finger. So touch my finger with yours. Same in this. Perfect. And then we are going to do the stereognesis test. So close your eyes for me and hold out your hand. And I'm going to put an object in there, and then you tell me what it is.
It's a pen.
Okay. And then again, hold out your hand, keep your eyes closed, and I'm going to draw a letter in your hand. You tell me what it is.
Feels like an 8.
Okay. And then same in this hand. You would just repeat as with the other one as well. And then we are going to do the vibratory sensation test. And so we'll take the tuning fork, and I'm going to the vibratory sensation test. So I'm gonna place it against the ulnar prominence on the wrist, and let me know if you feel it.
Yes.
Okay, and then same on this side.
Yes.
Okay, and then I'm gonna do it against the medial malleolus.
Yes. Yes.
Okay, and then from there, I am going to then I will do, so we did that, and then I'm going to move on to the, we'll do the light touch test on the upper and lower extremities. So close your eyes and tell me where I'm touching you.
Arm.
Okay.
Leg.
Okay. And then now I'm going to do the deep tendon reflexes. So we'll do the brachioradialis. Okay. And then we repeat on both sides. And then I'm going to do the biceps. You can just straighten your arm for me. Okay. And then same on this one. Okay. And then put your arm out like this for me, and I'm going to take all the weight of it. Okay. And then same on this side. Okay. And then I'm going to do the patellar. So the knee. Okay. And then both sides, and then we'll do the Achilles. Okay. And then I'm gonna do the Babinski reflex. So for this, I'll have you stick out your foot and take off your shoes and socks for the Babinski reflex test. Okay. And then we'll do it on both sides. And then I'm gonna move on to assessing the lower extremities. So we would do, I will assess the skin color, texture, temperature, moisture, turgor, any edema, scarring, bruising, or the lesions of nevi. And then we'll also assess the joints of the lower half of the body. We're going to do assess for any crepitus, pain, tenderness, nodules, swelling, assess the symmetry. So we'll start by doing the range of motion in the toes. So for this, you want to, if you could lift up some, just so we can get in the camera, but you would flex your toes down, extend, hyperextend, and then you want to, then we're going to do the ankle. So you'll do plantar flexion, point your toes down to the ground, and then dorsiflexion, heel, and then you'll do inversion where you turn towards your body, eversion out, and then rotation. Okay, and then we are going to do, I'm going to assess the strength in the ankles and the knees. So push against my hand, okay, and then push against my hand. And again, we would repeat on both sides. And then on push against my hand, push against my hand, okay? And so that assesses the strength in the knees, and then you can drop your leg. So then I'm going to assess the strength in the hips. So push against my hand, and then push against my hands, okay? And then from there, we will go to so then we're going to assess, I'll have the patient stand up, and we are going to assess the strength or the range of motion in the hips and the knees. So we'll face the camera, and you are going to, we'll do the hips. So what we want, if could just, let's see. Okay. So we will flex the hip, and then extend, and then hyperextend, and then we'll do abduct, which is away from the body. Adduct is towards the body, and then you'll do internal rotation, external rotation, and then circumduction in a circle, and then you repeat that on the other side. Then we'll do range of motion for the knees. So you would flex the knee, extend the knee, and then hyperextend the knee. Okay, and then since we already did the strength, so then we are going to move on to assessing the spine. So I'll have you turn towards that way, and then bend over for me. And then in this position, you're going to want to assess for scoliosis, assess for the alignment, the curvature of the spine, any obvious lesions or masses, or areas of tenderness or pain. So then you can stand back up, and we're going to do range of motion of the lumbar spine. So then bend forward again. So flexion, stand up, extension, lean back, hyperextension, lean to the right side, lateral flexion, the other side, lateral flexion, and then rotate. Okay, and then we are going to do a range of motion for the cervical spine. So then bend your neck forward, flexion, straight, extension, back, hyperextension, lateral flexion to the side, lateral flexion to the side, rotation, rotation. Okay, and then we're going to do the Romberg test. So I'm going to have you close your eyes, and then you will stick your hands, put your feet together, and then stick your hands straight out. Okay, and then we are going to assess for gait. So you can open your eyes now. So we're going to assess for gait. So then walk towards that way, just normal, so we can assess your gait. And then I'll have you come back and then walk heel to toe. Okay, and then back. And then I'll have you hop on one leg if you can. Okay, and then the other side. All right, and then I'll have you sit down. When we assess the hearing, I omitted the, we did the hearing test, but I omitted the, I'm sorry, the Weber test and the Rene test. So for the Weber test, we use a tuning fork to strike it. I'm going to place it in the middle of your head. You let me know if you hear it louder on one side versus the other, or if it's equal on both.
It's equal.
Okay, and then I will do the Rene test. So again, I'm going to strike the tuning fork. I'll place it on the mastoid bone, and you let me know when you stop hearing it.
Stop. Stop.
Okay, and so that's air conduction is greater than bone conduction, and I would repeat that on the other side. And so this concludes the head to toe physical assessment.